Tonsillitis is a condition that happens when the tonsils get infected. Symptoms typically include a fever, sore throat, and swollen lymph nodes. Treatment depends on whether the condition is bacterial or viral. Today we are learning or discussing tonsillitis, and we'll get to know what brings about it, what causes it actually, and what we can do when we have them, and also get to know how to prevent them from occurring. This time with Nurse Joycelyn. If today is your first time of watching my video, kindly subscribe to my channel for me, share and like my videos. Kindly keep your comment respectfully in the comment section for me. Stay tuned. The tonsils are two small lumps of soft tissue, one on either side at the back of the throat. You can see your tonsils in a mirror by opening your mouth and sticking out your tongue. Tonsils are part of the immune system and they help to trap germs that make us sick. When they become infected, they become swollen and sore, and then swallowing becomes difficult. The medical term for tonsillitis is tonsillopharyngitis, but most people call it sore throat because that is what it feels like. Tonsillitis is most common in children and adolescents, but can affect people of all ages. It rarely occurs in children who are under the age of 3. Most people have tonsillitis at least once in their lifetimes. Symptoms of tonsillitis come on suddenly and may include a sore throat, pain or difficult swallowing, red, swollen throat or tonsil, white spot on the tonsils, fever about 38 degrees Celsius, also swollen lymph nodes, stomach ache or vomiting that is common in younger children, and white, yellow or gray coating on the tonsils. Now, is tonsillitis a bacterial infection or a viral infection? What causes tonsillitis? Viral infections are the most common cause of tonsillitis, but bacterial infections can also cause it. Viruses like those that cause the common cold and flu cause up to 70% of tonsillitis cases, and commonly people with viral tonsillitis have milder symptoms than those who have bacterial tonsillitis. Bacteria like group A streptococcus cause other cases of tonsillitis, and a common name for bacterial tonsillitis is strep throat. People without tonsils can still get strep throat. In this case, it affects the throat instead of their tonsils. And like I said, bacterial tonsillitis causes more severe symptoms than viral tonsillitis. The viruses and bacteria that cause tonsillitis are highly contagious, and they are passed on along by kissing or sharing utensils, foods, or drinks, coming into close contact with someone who has it, and also touching contaminated surfaces and then touching your mouth or nose. Untreated tonsillitis can cause complications such as obstructive sleep apnea, tonsil stones, tonsillar cellulitis, and peritonsillar abscesses. People with untreated bacterial tonsillitis are at a higher risk of developing what we call post-streptococcal reactive arthritis. That is a joint pain and swelling that occurs within 10 days of a strep infection. Untreated bacterial tonsillitis can again cause rheumatic fever, scarlet fever, and kidney inflammation. How do we manage or treat tonsillitis? Like I said earlier, the treatment depends on whether it is bacterial or viral. And though the symptoms are similar, they are treated differently. So if it is bacterial, doctors or healthcare providers may prescribe antibiotics such as penicillin, clindamycin, or even cephalosporin. And it is very important to complete the full course of the medication, even if you feel better after a couple of days. Pain relievers such as ibuprofen and paracetamol can also be prescribed to ease the pain that comes because of the sore throat. Tonsillectomy, which is another treatment option, is a procedure to surgically remove the tonsils. How do we diagnose tonsillitis? To diagnose tonsillitis, doctors will check the throats for redness and swelling. After examining the throat, they will also go ahead and ask you about the symptoms you've had, such as fever, runny nose, cough, and others. This will also help us to rule out other conditions. They will look into the ears and nose for signs of infection and feel the size of the neck to see whether the lymph nodes there are swollen and tender. After confirming a tonsillitis diagnosis, your provider may need to do a further test, that is, bacterial culture test. The doctor may request this test to be done because it will help him to determine whether it is bacterial or viral. During this procedure, a provider will swipe the back of the throat with a long cotton swab to gather cells and saliva. Then the sample will now be checked to see if it tests positive for group A streptococcus bacteria. If the result comes out positive, then you have a strep throat. If it's negative, then you have viral tonsillitis. How do we prevent tonsillitis? Truth is, you can't totally prevent tonsillitis, but you can reduce your risk of getting it by practicing good hygiene habits, such as washing your hands frequently, avoid close contact with someone who has it, avoid sharing of utensils, foods, and drinks, and then changing your toothbrush at least every 3 months and at every time that you get sick. In addition to doctors' recommendations on how you can relieve symptoms of tonsillitis, you can also do these home remedies. You can take in warm liquids like tea, apple cider, or broth, gargling with warm salt water, and sucking on throat lozenges. This is the end of today's discussion on tonsillitis. I hope we've all learned something today. Kindly give me a thumbs up if you like the video, share for me, and also let your notification icons be on for new updates. I'll see you in my next video.